Thanks, Rhonda. Well, thank you so much for having me. I am so excited to see just so much interest in this topic. It is something I'm really passionate about and really just providing resources for parents and caregivers. So I will briefly tell you a little bit about myself. I did not realize that Katie was going to read my bio, so I appreciate the introduction. So I will keep this short and sweet. So a little bit about myself. I was born and raised in Miami, Florida, and went on to study at the University of Florida, then moved over from the Sunshine State to the state of Kansas, where I currently live and work. And I'm currently a postdoc researcher with the University of Kansas Juniper Garden Project. And I also collaborate on several different projects, like Katie mentioned, with the KU Medical Center and the Kansas Family Support Center. So without further ado, let's dive into our topic for this evening. So tonight I would love to really be discussing some ways that you can support your teens with autism or related disabilities. It looked like there were a few folks who mentioned oppositional defiant disorder, ADHD. So this talk is very, very general, and I would love to have it be very interactive discussion with you all. But it is general enough to where these strategies can be applicable regardless of diagnosis, really age. So try to keep it something that would be very user-friendly for all of you. But as always, please share feedback with us as well. So tonight we'll specifically be tackling these three main objectives. So first, learning about how puberty can impact behavior. Secondly, learning ways to identify and address changing motivations. This can be a pretty challenging time for all parties involved, and motivations can certainly change. And lastly, I'd like to show you some ways that you can identify and modify the environment using some behavior analytic strategies so that you can better support your teens with autism or other disabilities or learning differences as well. So like I mentioned, puberty, a difficult time for everyone, right? It's a time period that's really marked by so many changes, and it can be confusing and awkward and uncomfortable. And I'm sure that we can all remember how challenging going through puberty was and relate to some of the challenges that your teens may be experiencing. And as you can imagine, some of these challenges are probably being really heightened when you have, limited communication, limited ways of expressing your wants and needs so that they're heard by others, or maybe challenges around your executive functioning. So your ability to really take in the environment around you, respond to different things that are going on in your environment, and kind of respond in inappropriate ways. So it is a time marked with just so much learning from everyone, right? So confusing time, but let's talk through some ways that we can support those needs. So let's take a closer look at what some of these changes entail during puberty. So there are certainly lots of biological, hormonal, and physical changes that are occurring at this time. Although I'm a doctor, I am not a medical doctor. So as always, whenever I'm working with caregivers and parents, I always like to say that if there's something that feels off to you, something that's concerning, you're their advocate, you're the one who knows them best. So always recommend making sure that there aren't any medical causes for changes in behavior before kind of digging a little bit deeper. Once any medical causes can be ruled out, then that's the time that we can really start to work together and figure out some ways to provide some support. This is also a time that's marked by lots of emotional changes and fluctuations that are oftentimes associated with changes in hormonal levels and other biological factors. So things like, how much you slept, if you're really fatigued, how much you've, eaten in a day, right? Those are all things that can certainly affect us. I know, speaking for myself, if I haven't eaten or had caffeine, I can definitely be a bit hangry. Um, so along with a lot of these changes that are going on through puberty, the one that I'd really like for us to focus on today, and again, love to hear more about your experiences. And those are really going to be ones related to behavioral changes. So we may see teens struggle with changes that are not only happening, with their body, but also with their routine. There may be physical changes that are happening to them that now require them to have changes in their routine. So, for example, once females, and I'll try to stick with biological males and females for this talk today, that if they're now menstruating, they may now need to learn a menstrual hygiene routine. So that could definitely be challenging for sure. This time may also be marked with an increase in challenging behaviors, and we'll talk a lot about those today. We may also see an increase in some sexual behaviors, and I do really want to highlight here that these increased sexual urges, these sexual behaviors are absolutely natural. There is no room here for shaming that. But there are ways that it can be inappropriate based on the setting or the context in which it's occurring. So always want to be teaching some of those public versus private behaviors. Certainly focusing on consent as well. But there may be some concerns related to impulsivity or engaging in some of those sexual behaviors at the wrong time or the wrong place. And so it's really important to teach where are the appropriate places that you can engage in those behaviors. And then, like I kind of briefly touched on earlier, there are also likely some behavioral changes that are related to some of those fluctuations. So you may see changes in levels of engagement or social engagement, fatigue, eating, food consumption, so things like maybe avoiding more foods or overeating as well. And all of these different changes that are going on, whether they be biological, physical, emotional, or behavioral, these can all have an impact on your motivation, right? So I'd like to break down motivation and talk about it in more of a behavior analytic lens. And what I mean by that is I really want to equip all of you with certain terminology so that when you are advocating for your teen, whether they're your kiddo, step kiddo, foster child, that you are aware of different terms that may be used by different service providers, so that you kind of speak the language. I don't want to be too jargony, but I also want to make sure that you can advocate for yourselves and your family as well. So let's break down what motivation looks like from that lens. So when we think about motivation, or again, that term that I'd like to use instead or highlight is the term motivating operations. So motivating operations are split up into two different categories. The first is establishing operations, or EOs, and the other is the abolishing operation, or AOs. And these really sort of encapsulate or really capture some of these differences in motivation and what they mean. So when we're talking about establishing operations, what I mean by that is these are going to be different factors or different variables that are increasing the value of some reinforcing consequence or some reward, something that you typically enjoy. And with these establishing operations, what we typically see in terms of how it affects behavior is what we call a behavior altering effect. That was a bit of a mouthful. And it has this evocative effect. So that means that it increases the frequency or maybe even the intensity of a behavior to get access to the reinforcer. So to give a quick example, think about if you're having dinner, you've maybe just had pizza. It's pizza night at home, and now you want to have dessert, right? So you have been in what we call like a state of deprivation. You're not currently eating ice cream, adding all of your favorite toppings to the ice cream, but the value of ice cream has increased because you've had your fill of pizza, but now you want dessert at the end of dinner, right? So you may start to change your behavior to access that ice cream. So maybe you're asking siblings or you're asking your caregiver if you can have ice cream. Maybe the amount of requests that are made are going to be increasing during this time, or maybe even the intensity. So maybe the first time they request it, they might say a kind of normal tone of voice, conversation level. But after they've asked 2 or 3 times, maybe they're raising their voice a little bit more. So you see this kind of change in their behavior where they recognize this is something that's valuable, this is something that I want, and I'm going to change what I'm doing so that I can get access to it. On the flip side, abolishing operations are, in its simplest form, the exact opposite of what I just described. So abolishing operations are going to be those different factors or variables that are going to decrease the value of a reinforcing consequence or reward. And oh, I should have changed that on this. Let me see if I can use like the annotation feature on here. Just ignore that part. It also has a behavior altering effect, but what you're likely going to see is that it decreases the frequency or the intensity. And we'll just put a little D E here, decrease that behavior. So it has a decreasing effect. So you're likely going to see the frequency or the intensity go down because that reward or that consequence really isn't valuable anymore. So if we take the same pizza and ice cream example, if you have just eaten a bunch of pizza, you're likely not full. You might not want another slice of pizza, right? So that's what I mean by the value of that item or the value of that reward can change because now you're full, you're satiated, and you're not going to engage in behaviors to get more slices of pizza. Instead, now you've got kind of this motivation, this establishing operation in place to be requesting ice cream instead. So it's just kind of a quick and easy example, but if folks want to take a deeper dive into this or talk through some examples that you all might be experiencing at home, happy to go there as well. Does anyone have questions so far? Feel free to add them to the chat if you do have any questions. I'm not seeing them, so I'm gonna go ahead and scoot on over to the next one. So now that we've kind of gotten on the same page and know a little bit more about motivating operations and what they mean, let's talk about how we can identify sort of what I think about as like signs and symptoms of changing motivations. So again, be relating this all back to puberty and all of the different changes going on at this time too. So the first question and kind of the way that I'd like to go through this this information is kind of like a decision tree. So the first kind of step in identifying these changing motivations is to first ask ourselves, are they, and by they I mean teenager, are they experiencing a state of deprivation or satiation? So if they're experiencing a state of deprivation, has it been a while? Has it been, some time since they've had access to something preferred, like the ice cream, for example? That highlights a state of deprivation because it's something you don't currently have. Or are we seeing a state of deprivation, meaning they've just spent a lot of time accessing something preferred? So like with the pizza, we just ate a bunch of pizza. They don't want any more pizza. Another one that we often see that I should kind of give the caveat for is so many caregivers have shared with me that a lot of these examples do not translate when it comes to technology and, playing video games or watching shows or movies. So if your teen is someone who really enjoys gaming, loves technology, even when they have been playing for hours or watching something that they really enjoy for hours, they may still want to keep engaging in that. So just to kind of give that brief disclaimer. So once we've sort of asked ourselves, what are they currently experiencing? I want us to then think about, are they showing any signs that they're interested? And that can look lots of different ways. So are they showing any curiosity? Are they approaching that item or activity, or expressing themselves in a way that suggests that they want something? Or do they seem really disinterested, disengaged, maybe hesitant or avoidant of what's going on? And lastly, I'd say one of the biggest things too is ask them. Now, it sounds like a lot of the caregivers on this call have teens or preteens with lots of diverse communication needs and communication abilities. So this may look a little bit differently depending on your teen. And again, I will always say this and sound like a broken record. You're the expert on your team, right? I can bring, certain areas of expertise to the table, but ultimately you're the expert on them and you're their best advocate. So one of my main suggestions is just use simple and clear language, particularly with preteens going through puberty, regardless of their communication level. As much as we'd like for parents to stay cool and as the favorites, oftentimes that shifts and you're sort of met with this like, oh, I don't really want to be talking to them. I don't really want to do this. So if that's something that's challenging, we want to keep it really short and sweet. So ask them what's going on. And then use the communication modality that works best with your team. That might look like the nodding, pointing, vocalizing, or using an augmentative communication device as well. So once you've kind of identified the culprit responsible for some of these changing motivations, here's some strategies that can be used to actually address them. And again, please feel free to ask questions if you want some more specific examples of how you can do this with your teens at home. So if you've sort of identified that they're in this state of deprivation, they haven't had access to something that's sort of their favorite in a while, this is a really great time for you to provide choices. I like to keep it simple, maybe 2 to 3 choices at a time, Choice overload is absolutely a thing. You don't want to overwhelm them. So provide some choices, offer access to different things that you have within your means, whether those be activities or places that you can go to, and providing help. We always want to try to encourage our teens as they transition into adulthood to maintain as much autonomy and independence as they can. So providing help is something that's really great, and that can look very different depending on your teen. Now, the flip side, if they've had a lot of time with access to something preferred, they're really not interested in it anymore. They're getting bored, kind of their cup is full. That's sort of the time when you can see behavior start to kind of tip over from I'm bored to I have nothing to do. I don't know what to do with myself. So I'm probably going to do something that people don't want me to do. That's kind of engaging in some of those challenging behaviors, disruptive behaviors, things like that. So kind of prevent the escalation of that happening, that's when I'd encourage you to offer them access to something else. So try to get them engaged in some other activity that you can redirect them to, provide them with different choices, variety of things. Of course, you might have teens who are picky, or maybe they have very select or rigid interests. But if you can incorporate novelty, particularly for one of the caregivers who mentioned oppositional defiance disorder and ADHD, novelty is very, very important when we're talking about those motivations as well. So instead of offering the same 2 or 3 choices, try to rotate some of those out. Something that may also be helpful in those situations is kind of having like a pre-made like menu of here's some options of things that you can do when you're bored, or just as another tool that you can add. The other things that we can do to address some of these changing motivations, again, are they interested? Are they showing any signs of interest? If they are, provide help. And another one that often gets overlooked is providing praise for their interest and for their engagement. So it can be a very quick walk by. Again, teens can absolutely be moody. Attention may not be the most preferred in that moment. So however you can acknowledge to them and let them know that you're encouraging them to continue, that would be a great time. And what I call kind of catching them when they're being good. Let them know what to do versus what not to do, right? Now, if they seem disinterested, hesitant, disengaged, or avoidant, this might be a great time to check in with them, see if they need a break. If they're doing something that's really difficult, maybe non-preferred, you can always remove that item. You can always go back and reintroduce it or revisit it later if they are a bit more interested, or if they are showing some signs of kind of readiness as well. And again, redirect. You're going to hear me say that a lot this evening. Redirect to some other choices if they aren't currently interested in what they're doing. And then again, once you've asked them, based on their response, either provide or remove access, dependent on how they respond. So, how is all of this related? We've got puberty up here at the top. We've seen a few examples of how puberty affects your behavior, and your behavior can either be kind of in one of these 2 categories. It can be appropriate or desirable, or it can be inappropriate and challenging. And when I'm using the term inappropriate, I mean it in the sense of it's inappropriate because it's maybe something that's dangerous, it's happening too often, or in the wrong context. So think about, greeting someone. That's typically something that I'm sure we could all agree on. That's an appropriate behavior. That's an appropriate response to greet someone. Now, if you greet someone 20 times, that's no longer appropriate, right? It's not contextually appropriate anymore. So again, want to just kind of illustrate that inappropriate does not mean bad, or that your teen is bad or anything like that. It's just a label that we can use to kind of describe what's going on. So let's kind of dive a bit deeper into how all of these things can fit together. So here are some behavior analytic strategies that we can implement on the proactive or the preventative side of things, especially again when you've got lots of different factors working against you. So if they are having like a really big growth spurt, for example, I remember personally when I was younger and I was going through my big growth spurt, like I had terrible shin pain. So, when my parents would ask me to go do different chores around the house, I was not particularly happy or necessarily willing to always do that. So, if your teen is experiencing, a big growth spurt, maybe they're going through some big hormonal fluctuations as well. They're really fatigued. They're just maybe not eating enough or eating too much. All of these things can absolutely impact their behavior and their motivation. So these are some things that I recommend doing on the front end or in a proactive way, particularly if you're able to kind of anticipate some of the needs of your teen. If you've noticed that there are certain patterns that you're like, hey, around this time of the month, this seems to be a time when we see an uptick in some challenging behaviors, or we just have a lot more struggles at home. These are some ways that can address that. So the first is providing high quality attention. That can look lots of different ways. It can be conversation, comments, compliments, descriptive praise, expressions of care, preferred forms of physical attention, especially if your teen has lots of sensory needs and enjoys sensory input. Maybe that's, sensory squeezes or hugs or pressure, things like that. On the flip side, if your teen does not like attention, then maybe withhold that. Maybe be a little bit more nonchalant, a little bit more hands off. All kind of depends on what's going on. Another great preventative strategy is providing access to high preferred items and activities, as often as possible, whatever's feasible, but particularly during downtimes or before some challenging situation. And we'll go through some examples of what that looks like in just a minute. And then, like you've heard me say several times this evening, provide choices, things that they can do, different items, activities, give them options. Sometimes it can be very overwhelming navigating all of these different emotions, changes that they may be experiencing in their body. They might be struggling with their executive functioning, and they might be in this like task paralysis, right? Where they don't really know what to do or how to articulate how they're feeling. So a lot of these preventative or proactive strategies are really aimed at how can we keep them engaged and how can we make things easy. So that's kind of the general theme. And the last one here is making sure that we're using simple, clear instructions, set rules and expectations. You can use, oftentimes you'll see a lot of service providers use if then or first then statements. So, morning and bedtime routines can definitely be an uphill battle at times. So you can use things like, hey, first we're going to go ahead and brush your teeth, then you can play with this. Hey, first we need to finish your homework, then you can play video games. Or, hey, if we get our bath time done quickly, then you can have some free time on your own. Things like that. And then if at all possible, making the task or the situation more fun, more engaging and easier, like I mentioned before. So I'm especially thinking the one caregiver who mentioned oppositional defiance disorder. But again, this is applicable for really all teens. Providing choices is going to be so helpful, and I hope gives you um, and your teen, or like just positive impact, or has a positive impact, I should say. But again, especially with oppositional defiance disorder, a lot of times it's, I don't want to do it the way that you said it or when you want me to do it. So if that kind of captures what's going on, please let me know. But this would be a great time to tell them, how do you want to do the task? What materials do you want to use? When do you want to do this? Or having them pick kind of the order. That is awesome, Amanda. I'm so happy to hear that providing choices is working well. It's something that can oftentimes go kind of overlooked, but that's wonderful. I always think about it in terms of like partnering with your kids or partnering with your teen and having them provide input into how their day looks like. We have so many choices and so much autonomy in our daily lives that we want to equip them with those same skills as well. Another big one is providing help. Maybe they aren't completing something, or maybe they're having difficulty with something because they're really tired. Maybe they're pretty moody. Maybe they're experiencing some discomfort. Maybe they aren't quite sure how to do it or where to start. So providing help is always another great tip. And embedding whatever you're asking them to do in a preferred activity, or using preferred items as well. Now, these are some general good practices that I'd like to quickly go over before we get into some case examples. And then again, I'd love to have the floor open to folks providing just what's going on in your lives and how we can kind of provide some support for you. So when challenging behavior does happen, these are what I call like the 3 R's. So these are good to implement for everyone, regardless of age, regardless of whether or not they are currently in the throes of puberty or preteen or even an adult. The 3 big things are to refrain from commenting on the challenging behavior, which can be a lot harder said than done. But when your teen is maybe having a temper tantrum, they're having a meltdown at home, maybe they are throwing things across the room or throwing things at you or at siblings, it can be hard to say, stop throwing that. But important to refrain and instead tell them what to do. So using that second strategy that's listed here, redirecting. So redirect to another appropriate behavior. So if they are throwing something, tell them, hey, I need for you to please sit down. So having them sit down calmly, because then you can implement strategy number 3, where you reinforce or you reward the appropriate behavior when it happens, or attempts to engage in the appropriate behavior. So a lot of times this can be a tricky concept, because when we're talking about these appropriate behaviors, we're not looking for perfect. I'm not suggesting perfect, just as long as it's something that is safer than what they were previously doing, or if you see that they are trying to follow what you asked them to do, that's when I want you to give those shout outs, breaks, and things like that. So these are just some general ones, and we'll go through a few specific things in an example. So here is kind of an example of someone who they change things around just for confidentiality, but I was fortunate enough to work with a young woman named Betty. She was about 19 years old at the time when I was working with her, and she had limited communication skills and she was diagnosed with autism. She also experienced PMS or premenstrual syndrome and lots of menstrual discomfort. And with some of her limited communication skills, she really struggled to express herself and communicate things related to being, experiencing discomfort, fatigue, and just her general needs in an appropriate way. And caregivers, one of the big things too with this family was that caregivers reported that it was really challenging for them to track Betty's menstrual cycle. And the best way that they could describe it is they knew it was going to be happening at least once a month, but that the way that they really knew what was going to, be facing them that particular week was that Betty would start to engage in heightened levels of aggression. So she would push her caregivers. She would try to scratch them. She was a lot more irritable, less likely to follow instructions, and really, really, really did not want to complete her hygiene routine. She really wanted to self-isolate, didn't want to engage in others, and caregivers again reported she seems like she just has a very short fuse, and they felt like they kind of walking on eggshells and weren't sure what to do. So if this sounds like something that you've experienced, hopefully the next slide will give you some good ideas of what you can do. So this is the plan or the solution that we offered to the caregivers, and we worked on creating this in collaboration with them. So whenever Betty was experiencing symptoms of PMS, or she was menstruating, or they noticed some of those early signs of irritability, what we had caregivers do was decrease some of the overall demands and requirements. So again, make things a bit easier during a time that can be paired with lots of discomfort. Offered her choices, 2 to 3 choices, and kind of limiting some of those worked really well for her. And some of the choices that were offered to her were, things that she wanted to eat and her comfort meals, comfort items. She had this like weighted stuffed animal that she liked to use. And eventually we were able to actually find one that looked like her stuffed animal that could also be put in the microwave and used sort of as a heating pad that she could apply to her abdominal area for cramps and things like that. So offering her some of those choices was helpful. Simple and clear instructions all day, every day. We tried to limit the amount of instructions again, but when caregivers did need to have her do something, they broke the tasks down and they either completed most of the steps for her or the steps that were most challenging for Betty. And then whenever they were completing something, they provided lots of frequent breaks, and they offered lots of preferred items and activities. So like I mentioned, stuffed animals, really loved pillows, in her favorite movies. She wanted to do what probably many females who've experienced PMS kind of experience, where you kind of just want to be left alone. You want, some chocolate, a movie, and your bed. So we tried to simplify things for them. And this was a really effective strategy. And when it came to tackling her hygiene routine, this was particularly helpful. Betty was not using the toilet independently. So we would offer her the choices of if she wanted to wear like an adult diaper brief, or if she wanted to use menstrual pads or menstrual briefs that are like underwear that are a little bit thicker. So again, she had the opportunity to have some autonomy, choose what she wanted, but that way caregivers could still ensure that she was maintaining good hygiene during that time. So that's just a quick example. Um, I have some other general tips to kind of summarize everything that we've been talking about. So I'll leave this here for a second.